Okay, well, let's go ahead and get started, and people can join in as they log on. Again, want to welcome you to our Safe in the South Bay event. This is our sixth one, and this one is about mental health. It is Mental Health Awareness Month, and we'll talk a little bit more about what that means. And our goal today is to provide facts and resources, tips and perspectives about how residents can live in the COVID-19 era. And we've got experts that represent different sectors that are going to help us with that. As I said, this is our sixth one. This started out with a partnership with the business community and has evolved into a much broader program. And we're very thankful for all of our partners, which you see many of them there on the slide. And again, we think it's real important to focus on mental health. Obviously, it's Mental Health Awareness Month. But we want to really look at the impact of COVID-19. We knew going in that that there were mental health and emotional mental health issues in the South Bay, and we're really seeing that exacerbated by COVID-19. Nearly half, or 49.4%, of Beach City's adults reported experiencing stress yesterday, according to the Well-Being Index that's done by Gallup, and that was done in 2020. And so I think we're all experiencing that. So one thing we just want to make sure people know is that you are not alone. And again, this is something that's affecting everybody for every age group. Uncertainty, isolation, losing our sense of safety and security. Those are all things that are impacting our mental health. And we hope that this webinar will provide you with some useful information and perspective on how to build our coping, resiliency, and re-emergence skills as we reopen and come back into society. I had the opportunity to fly last week safely, and that was definitely re-emerging is a kind word for it. So again, we're providing mental health programs and tips and resources to let you prioritize and support your mental health as we continue to live through and recover from the remainder of this pandemic. And so you can participate in Mental Health Awareness Month a few ways. One is by completing the virtual mental health and happiness series. And so you'll have some more information about that. You can do an act of kindness each day with the kindness calendar. So that's a tool that we have for you. And then you can attend a virtual event like today's Safe in the South Bay series. And so those are just a few of the things that you can do to be kind to one another and take care of your mental health. So we really are pleased that you're here today. I'm just looking to see if Lori has joined us yet. Lori Glover, co-founder of the Redondo Beach Chamber of Commerce Health and Wellness Committee. And Lori's either going to say a couple words now, or if she's not on yet, then Melissa will jump in and start the program. Melissa and Lauren will.
Thank you so much, Tom. Thanks for being with us. So my name is Lauren Nakano, and I'm going to be emceeing this event with Melissa Andrizi-Sobel, who's my colleague at the Beach Cities Health District. We're really honored and happy to be with you today. And as Tom said, Lori Glover will be joining us, and I think we're going to have her close out this event with us because she and Cheryl have been a really tremendous partner. So wanted to just go over some ground rules and tips and tools as we are all joining the webinar today. We are in a webinar Zoom mode, so we are going to be using the Q&A feature on your screen, and that is at the bottom of your screen typically, and there's a Q&A box that you can use to drop in a question if you have a comment that you want to share. And we're really happy to take questions as you are listening to the speakers. If you have a question, feel free to drop your question in the chat, and then we'll go ahead and ask those during the Q&A section of this event. We also, you will not be on screen today. So we encourage you to use the Q&A. We are recording this as Tom mentioned, and so we will be sharing this in a post-event email that will include also some of the resource links and the contact information to reach our panelists after this webinar is over. So we're hopeful that that's going to be a nice resource for you as well. So our time this afternoon together, we're going to have sort of 3 segments of this webinar. And the first is that we get to really listen and learn to our panelists. We have 4 incredible panelists that Melissa and I will just in a short while will introduce them to you. And to just get some really important information and facts about mental health and the impact that it's had across the lifespan. Then the second, we did get some really great questions that were pre-submitted through the registration process. So we'll kick off with those Q&As and have the panelists respond. And then we will also open it up to Q&A. So any questions that come through the chat, we're very happy to consolidate those and ask those questions of our panelists. And then we also have a surprise guest that wasn't on the flyer, but our chief medical advisor, Dr. Bill Kim, will be joining us because we did see in the pre-submitted questions that people have a few questions about vaccinations and the recent opening of the 12 to 15-year-olds. So he will be joining us a little later today. We also have added to our Safe in the South Bay webinars poll questions because we have really enjoyed being a little bit more interactive with the audience. So we're going to kick off the next section of this with our first poll question. And the first poll question that Tiana is going to pull up is, taking all things together, how happy would you say you are? And you can scroll down because there's a 1 to 10 choice. So go ahead and click the appropriate number for how you're feeling today. And then we will, and we have several questions, poll questions that we'll do throughout the webinar. So we hope that you'll participate with us. And then at the end of it, we're going to go ahead and post the results and just kind of see where people are at. Right. So thank you for sharing, very honestly, I think, we can see we have a range of responses here. And so hopefully your time with our panelists will provide some information, but also some context and reassurance and also coping and resilience skills that may be helpful to you all. So, all right, so now we're going to kick it off. I'm going to turn it over to Melissa and we're going to introduce our panelists.
Thank you, Lauren. Good afternoon, everyone. My name is Melissa Andrizi-Sobel, and I'd like to start by introducing our first panelist. Her name is Dr. Ioana Powell, and she is a PsyD. Dr. Powell is the clinical psychologist at the Stramski Children's Development Center, where she supports the medical team through psychological assessments, consultations, appropriate referrals, treatment recommendations, school assistance, and support for the patients and their families. Dr. Powell works alongside Dr. Gary Feldman and Melissa Frey in the Fragile X Clinic at Stramski as well. Dr. Powell works closely with parents, legal guardians, and teachers for coordination of care that is in the best interests of the children and adolescents who are referred to the center. Her clinical experience includes working with children, adolescents, and adults over the years. She has worked with children in foster care, youth on probation, children and teens with emotional, behavioral, and developmental problems, as well as medically fragile children. She has worked with individuals, couples, and families with substance abuse and dependence, marital conflict, adoption, physical and sexual abuse, and poverty. She has received training and certification in suicide prevention, trauma-focused cognitive behavioral therapy, and mediation.
Thanks, Melissa. Next, I have the honor of introducing Edna Osapons, and she is a licensed clinical social worker With 20 years of experience working with children, teens, adults, and families struggling with mental health issues, addiction, trauma, homelessness, relationship and family issues, acculturation issues, and grief and loss. She grew up in Los Angeles, where she spent her adolescence exploring its many wonderful parts. Edna has also received her education in Los Angeles, her bachelor's degree in sociology from UCLA, and a master's degree in social work from Cal State Los Angeles. She is passionate about working in her community and making a positive impact. Edna is thrilled to be part of the UCLA behavioral health team and as a social worker and continuing her community work with adolescents and older adults. So thanks for being here, Edna.
Thanks, Lauren. I'd like to introduce Howard Barker. Howard Barker works to engage, educate, and support the South Bay community for Clear Recovery Center. He is focused on spreading education and awareness on issues surrounding mental health and substance abuse, as well as helping families navigate the difficult waters of getting a loved one help. Howard has spent the past 7 years working with young adults and their families and being a support during times of crisis. Thank you, Howard, for being here.
And our fourth panelist is Dr. David Hart. He is the Director of Community Health at Always Best Care Senior Services and is a faculty member in the Department of Counseling at Cal State Fullerton. He holds his PhD in mental health counseling from the University of Missouri and works with a variety of clients, but primarily specializes in counseling older adults and their families. And Dr. Hart has been a really wonderful partner with us in our community services department that Melissa runs, to be really a support and a contact and information source for a lot of our residents. So thank you, Dr. Hart, for being with us.
So now we are going to do another poll question before we have Edna present today. And so the next poll question, Tiana, thank you, is, so as of today, how would you describe your current stress level? 5 being the highest and 1 being the lowest. Please pick one option. Thank you for sharing the results, Tiana. Okay, so overwhelmingly, we have about 90, almost 90% is everyone's kind of feeling at that midpoint to high. And so really looking at that 4 and 5, which, you know, again, really that high stress level, I think we're really going to benefit from our next speaker, who I would like to introduce. Edna Ospens, thank you again for joining us. And she's going to be sharing information related to stress findings and adults. Thank you, Edna.
Thank you so much for having me. Good afternoon, everybody. Perfect segue, because that's exactly what I'm going to focus on, stress, and particularly pertaining to adults and the impact of COVID that has had on our mental health. Okay, so next, please. So I want to take a moment and reflect on the year we've had. So looking back at 2020, I think a lot has happened, right? So I think for me, the year started on a very sad note with the passing of Kobe Bryant back in 2020, or January of 2020, and along with his daughter and the rest of the helicopter passengers, the passengers on that helicopter, right? So I think a lot of us felt that grief, and not just here in Southern California, but around the world. And I think that that loss, that sadness kind of foreshadowed what was to come, right? And of course, a couple months later, COVID-19 happened and it was declared a global pandemic. And of course, our lives changed, right? And the pandemic changed the way we work, the way we learn, the way we socialize. It changed the way we exercise. It even changed the way we grieve. And so along with these major adjustments and major changes came feelings of uncertainty and fear, especially in the beginning when we really didn't know what to think and who to trust and where to look for answers. And I think that caused a lot of stress and anxiety, right? And then, of course, with the lockdown came feelings of isolation and loneliness, and families were separated, we were forced to social distance, and with that, it was like the opposite of what we needed, right? Because in the time of stress, in the time of crisis, we want to be able to gather with family and friends and, really feel their support and comfort and feel, the healing nature of hugging and consoling. And that was stripped from us, right? And with the pandemic, of course, came an economic breakdown where millions of people lost their jobs, businesses closed down. So a lot of people were feeling this financial stress, this financial insecurity. And of course, that led to a lot of anxiety and stress, right? And if that wasn't enough, 2020, I think, brought with it or highlighted a lot of like social issues that this country has been having, right? Including racial injustice, including police violence, and all this amidst a political climate where there was a lot of polarization. The nation felt like it was divided, families and friends felt like they were divided, and of course, ultimately leading to political unrest, right? So to say it's been a stressful year, I think it's an understatement, right? And I think we can all agree that a little bit of stress is good for us, right? It motivates us, it challenges us to do, to accomplish complex tasks, to problem solve, but to have this prolonged level of stress for so long, that's not good. And it negatively affects not only our health, but our mental health. And there's emerging data saying that people are reporting increased levels of depression, of anxiety, and stress in general. Okay, so at least during COVID. And so I want to focus on one survey that was recently conducted by the American Psychological Association. And every year they survey about 3,000 people, Americans, and they ask them about their stress and the coping skills that they use to kind of deal with their stress. And this is what they found out this year. Actually, I should say, the title of the survey was Stress in Time of COVID, of course, appropriately named, and you can access that on apa.org if you like. So the survey found out that 78% of American adults said that the pandemic is a source of stress for them, right? So that's about 8 out of 10 people, quite a high number, right? 67% of American adults reported that their stress has increased over the course of the pandemic. Again, quite a high number to report. Parents in general are experiencing a lot of high stress as well. So 45% of parents surveyed said that their stress is high during the pandemic versus 28% of adults who don't have kids. And of course, this is relating to the fact that parents not only have they had to work from home, but they've had to take care of their children's needs, including remote learning, including meal preparation, including arguments with siblings, and so on. And of course, they've had a very stressful year, right? When it comes to moms, they're not doing well either. So 50% of moms said that their mental health is worse now than before the pandemic. And of course, that's a high number. And this is pertaining to the fact that moms in general in our society have the added responsibilities of not just taking care of their kids, but taking care of the home, as well as managing their own careers, right? And then when we talk about essential workers, 25% of essential workers were diagnosed with a mental health disorder during COVID. So that's almost 1 out of 4 people, essential workers. And that's quite a high number, but it's also understandable, right? Because essential workers have been putting their lives at risk every day to take care of us, right? And putting their families' lives at risk. Especially healthcare workers who not only are they dealing with that danger and that risk, but they're also dealing with a lot of trauma, right? Relating to death and dying and grief and feelings of helplessness and things of that nature. So it's understandable that it's been quite a stressful year for them. Next, please. So this survey not only reported that Americans are very stressed or they're experiencing higher levels of stress, it also reported that American adults are using unhealthy ways to cope with this stress. In fact, it reported that Americans have gained weight during COVID, they're not sleeping well, and that they're using increased levels of alcohol to cope with their stress. So I just want to focus on these statistics for 1 minute. Okay, so as far as weight gain, 42% of adults said that American adults, I should say, said that they've gained weight during COVID with an average of 26 pounds, right? And so that's a lot of added weight to carry, right? Those who have gained weight, about 10% said that they've gained over 50 pounds. Again, quite a significant number. And then parents and essential workers are doing poorly as well. So parents, 51% of parents said on average that they've gained about 36 pounds. And then 50% of essential workers said that they've gained about 38 pounds. And so we know that, having that added weight gain is gonna affect your health negatively, and it's also gonna affect your self-esteem. It's gonna affect your mood. And then in return, it's going to affect your productivity, right? Next, please. So as far as sleep changes, so 67% of Americans who were surveyed said that they did not sleep well. They had sleep disturbances during COVID, right? So 35% said they slept more, and then 31% said they slept less. So again, if you're feeling tense, if you're stressed and depressed, you're not going to be sleeping well. And of course, that in return is going to affect your mood as well as your health, right? And then as far as alcohol use, 23% of adults said that they've increased their alcohol use to kind of cope with the stressors of COVID in 2020. And that number actually doubles when you're talking about parents, and parents, especially with younger kids, elementary school kids, right? So 52% of parents said that they've increased their alcohol use, So, these statistics are quite alarming, and it's hard to hear. But at the same time, I do want to note that 7 out of 10 surveyors also said that they have hope. They have hope that they're going to get through the pandemic, that they're going to be able to get back to normalcy and to be stronger at the end. So it's always good to remember. And although the stressors of 2020, they're not just going to magically appear and disappear. In fact, we have to actively adopt healthy coping strategies to kind of cope with the stressors that we've had. And that's what I want to end my presentation on. If you can go to the next slide, please. Just some helpful and healthy coping strategies that we can all, I think, incorporate into our daily lives. So first, just know that feeling overwhelmed is normal. It's a natural reaction to stress, so you are not alone, okay? So that's important to remember. Next, practice mindfulness. And I know this sounds a little time-consuming, but deep breathing is a very simple, inexpensive, and effective way to practice mindfulness. So taking 3 deep breaths every hour, or as often as you can, is going to really release some of that tension that you're feeling, okay? Next, focus on self-care. Dedicate some time during the day to focus on some me time, right? Do something that you enjoy, whether it's watching your favorite TV show, whether it's taking a long hot bath, or baking some sourdough bread, something that's going to bring a little bit of joy into your day, right? Next, exercise. I can't stress the importance of exercise, especially on our mental health. If you can take maybe 15-20 minutes out of the day just to walk, to stretch, to move, just to be active, I think that's going to really release some of the stress that you're having. And for me, yoga has been my savior throughout COVID. And yoga is not only good for our body, but it's good for our mind. It forces us to be present and in the moment, and also regulates our breathing. So a lot of good qualities. And the good news is there's a lot of free resources online that you can access, right? Next, express your feelings. Share your feelings either with a loved one or with a professional. And I think this is important because just releasing some of the emotions, you're going to realize you're going to feel lighter. And then you might also realize that the person in front of you is feeling the same way too, right? You're going to get some validation in that. Next, practice gratitude. I think it's important to take a moment out of your day and acknowledge something, one thing that you're grateful for. And I think you'll see that along the way, you'll see that that you have a lot to be thankful for or grateful for, and a lot to be positive about, right? And next, take a break from news and social media. I wish I had more time to kind of focus on this, but I think a good resource to have is the documentary on Netflix, Social Dilemma. I think it's a good learning tool for everybody and a good tool to have if you have kids especially. Lastly, mental health matters. Just want to end on this note and say, it's important to not only focus on our physical health, but our mental health as well. And I know there's still a lot of stigma attached to this topic of mental health, but hopefully talking about it today with you guys and, raising awareness, we can kind of reduce that stigma together and bring a little joy into our lives, right?
Thank you, Edna. That was really powerful, and especially this last slide. So thank you for these helpful hints.
Thank you. Thank you for having me.
Yes. And now we'd like to transition into our next poll question. So Tiana, if you can please share that. So this next poll question is, do you know a young person who has been emotionally withdrawn during the pandemic? And thank you for sharing the results, Tiana, when they're ready. So again, overwhelmingly, we have about 73%, 43% no, 50% yes, and then 7% not applicable. But again, half of us have known a younger individual who has become emotionally withdrawn. And so I'd like to introduce Dr. Iona Pal, who will be presenting on our youth population in the community.
Thank you, everyone. And thank you so much, Edna, for the numbers, because I'm not going to talk about many of the numbers, but it's definitely nice to have that as a perspective, because this pandemic has certainly been an interesting social experiment, right? And I might say some things, some words that may trigger some people. That is not my intention, but I also don't want to sugarcoat what we've been dealing with, and especially what the kids have been dealing with. So I apologize in advance. I'm more than happy to answer any questions at the end, but I just kind of wanted to talk about how things have been going, because it's been affecting kids, teens, everybody. It doesn't matter what age, from toddlers who've never played with another kid in the last 16 months, let's say, or teens who are now more comfortable being online than seeing their friends in person. Some kids are okay, they definitely are, but some are definitely struggling, as we saw from Edna's numbers. So let me just talk about anger. I'm not going to focus on everything else, but let's start with anger at the virus, at changes, and how it changed, or dare I say, forced our circumstances, at our government, you name it. Anger is there. It's a very easy emotion, and it comes out without much practice, with much less than other emotions to come to the surface. And that anger was certainly felt by parents, continues to be felt, and has maybe led, as Edna said, to substance use or abuse, poor eating and sleeping choices, or just stress, as was mentioned. And that stress felt by all of us was definitely felt by parents, that trickled down to and experienced in children. And kids, because depending on what age we're talking about, may not have a good understanding of what that means. So they created their own versions of stress and anxiety or depressive symptoms. And sadly, there has been an increase in self-harm, poor self-image, and very low self-esteem in children as young as 7. Believe it or not, I have listened to kids as young as 7 telling me that they wanted to die. They don't understand what's going on, and everything would be better if they just were not here. So as children transition to virtual learning, learning to navigate breakout rooms, moving to hybrid models, perhaps still in front of a computer screen, but in a classroom, and now back to school, they experienced many feelings. The assumption was, and I think still is for many, that kids are resilient, they'll be fine. And that may be so for a lot of kids, but how are they to know or practice good resilience or adaptive skills if they've been isolated from their friends? They haven't been able to rid themselves of extra energy by playing tag football for so long, or perhaps when they've been seeing bits and pieces of the news or hearing their parents arguing, or just being at home among their family members 24/7, right? For some families, the kids haven't had much direction or developmentally appropriate information. For other families, thanks to good planning and organization on the part of the parents, structure and schedules and all that helped, and everyone stayed on some sort of focused track. But for the parents who have been stressed, like the polls showed, working from home or have lost a job or loved one, they may not have had the energy reserves to be fully present or singularly able to support a special needs child or 3. And that's not good or bad, it's just reality. We all have felt the effects of the pandemic in one way or another, leading, like Edna said, to more snacking, drinking, more yelling, shorter fuses, feeling burdened, more guilt, that's definitely there. All of that has been visible or palpable to kids. Or perhaps you or someone you know is that super parent who has held it together all this time, made charts and planned creative scavenger hunts around the house for your kids, and have sheltered your child from all your own feelings of uncertainty and sadness, all while limiting fun screen time to under 2 hours each day, right? There's no manual, at least I didn't get mine in the mail about this pandemic. However, I want all of us here to consider something aside from all the numbers. How much do we really know about one family's hibernation experience? More than ever, we, kids included, had the chance to present ourselves on social media. Here goes. On Zoom, dress it up, apply concealer to any situation or meeting, change the background, or turn off the camera. How much sadness, domestic violence, substance use, overeating, oversleeping, abuse, neglect, or reliance on digital babysitting occurred between those sessions when the cameras were off? We don't know. We have some numbers, and that's definitely good to go on to start somewhere, but we don't know. And as we become more aware and accept the fact that all of us have been affected by this pandemic, we undeniably become better at noticing and hopefully treating its effects on the young ones. Yes, there's certainly significant increase in anxiety, a lot. Depression and suicidal ideation in children, as I said, as young as 7. And yes, this is very serious and concerning, and we definitely need to act now and be ready just to do whatever is needed. But how we do it is definitely something that matters too. Providing education, workshops like these, and mental health support and training to teachers, I believe increasing the use of screening measures or more screening measures during regular doctor visits, and continuing to have support groups available for parents, for teachers, for anybody in the community, free of charge, hopefully, right? Will increase the chances of kids, parents, and families moving on. So education and access, I think, is what we definitely need at this point. Because we talk about resilience, and I'm going to talk about it right now, is important, but we need to be able to help someone use that resiliency base. So that the resiliency, emotional resilience, is the ability to bounce back. And we must teach or remind one another what that means and how we do it, right? It's not about being unaffected or acting like there are no scars for the kids, but rather moving past this with new understanding, appreciation, and hope. And I think that word hope will be mentioned a lot here today. Uncertainty, isolation, structure, financial changes, all that are givens. We know that, or at least we hear it. We hopefully understand what that means. But I think we need to work together like this. Physicians, psychologists, social workers, teachers, um, community leaders, baristas, and grandparents, anybody. The more we share our knowledge, coping strategies, and resources like this, the better chance we have to heal the kids, to support them as they safely go back to social and physical activities, as they return to lunches and recesses outside. I think that's the plural of recess, I'm not sure. As they throw or kick a ball around without hurting themselves, as they go back to field trips, right? How scary is that? Kids spend a lot of time in front of screens for over a year, whether it's because they had to for school, they wanted to because, hey, Fridays at Freddy's, I hear, and Roblox are all the rage, or because it was just necessary as a parent needed to take a break, right? But we can reverse digital addiction, and we're seeing a lot of that. Decrease social and separation anxiety, which is what's happening to a lot of the kids going back, re-emerging, coming out of the cave, whatever you want to call it. Provide support and slowly get those kids back on track without sports injuries, without panic attacks, without too much social awkwardness and behavioral problems, and hopefully with enough confidence, self-worth, and hope, that word again, hope, so that kids don't feel like their families would be better off without them, which is very, very sad. So let's put ourselves into their shoes. We always ask them to put themselves in others' shoes, right? Let's put ourselves in their shoes, do the work, and prevent long-term psychological effects. We can do it if we collectively accept responsibility and shift from a fear, worry, blame kind of mentality to emotional resilience, and help in whatever way we can within our own limits, right? And it will get easier. Mental health means knowing when our resilience tank is running on empty. That's what mental health is a lot of times. And when we need and what we need to fill it back up. So essentially, I want all of us here to think about what it takes to refuel those tanks as we reemerge into whatever the new normal is for us, for kids, for everybody. So, do you need someone else to watch your child as you recharge your own batteries for a week? Can you afford that? Do you need to spend time with your family but away from home? Do you need a new job? A lot of us maybe have considered that during the pandemic, right? A lot of things have shifted. A lot of that stress is asking a lot of questions. Do you need therapy to work through something? Does your child need therapy or a new IEP at school? What does your child need? And you can ask them if they're old enough to tell you, they know, they'll tell you. Do you need a plan? Do you need to plan a play date for a kid, for a toddler who hasn't been around kids and doesn't know what that means? Get on it. That's going to be very, very essential at this point. Are you okay with with your child going to the movies right now, not worrying that they're not going to wash their hands or wear their mask in between popcorn and sips of whatever they're drinking, right? Do you need to accept that your child has been fine, but you are the one who is worried and needs to learn more about frustration tolerance, anger management, or asking for help a little more from those around you? Or do you need to fight with your child a little about washing and brushing their hair, putting on deodorant, and walking out the door wearing shoes? I hear that a lot. The biggest concern of most 12-year-olds is, now I got to get dressed for school and I got to wear the uniform and I have to put shoes on. If that's your biggest battle, not something that you can't address. So I want to finish with that and say, we need to remember all of that. And remember how I said baristas are part of that collective? How nice is it when they remember your order? And let's say you've had a really stressful day, you're going back to Starbucks, whatever your coffee of choice place is, right? you're going in, you're thinking about the fight you just had with your partner or with your child, and they get your coffee right there. And you just take that first sip and you're like, oh my goodness, that is exactly what I needed, right? Sometimes it's the small things, sometimes it's bigger and we need therapy, right? Or support from the community. But sometimes those little things like that perfect sip of coffee or tea, whatever it is, just makes you be more hopeful, gets you through your day. And I think this is a nice step. We don't have enough time to discuss about all the options nor the resources that are out there, but I think together today we can provide a little bit more normalcy, and we can provide a little bit more hope about what we can do, whether it's for a 3-year-old, a 7-year-old, or a 67-year-old. So with that, I'm done for right now. Thank you.
Thank you, Dr. Paul. And you know, what you just said reminds me of a term that we use with the work we do, which is about savoring gratitude. And I think what you just said is really important. I also want to thank you for your honesty. I think we need that right now in this conversation that we're having. So really appreciate that. As we transition to our next speaker, I would like to get you to start thinking about risky behavior. And so I think Tiana is going to pull up the poll. So the question is, have you noticed an increase in risky behavior in yourself or others during the pandemic? We'll see what you all have to say. As we see it coming in, it's fairly equal right now. Okay. Great. So the results are fairly balanced, I'd say. You know, about half of the group here has seen an increase in a risky behavior, either in yourself or others, and then the others have not. So that's probably a really nice segue to Howard Barker, who's a community liaison for Clear Recovery Center. And Howard, thank you so much for being with us and sharing about substance use.
My pleasure. It's great to be here. And I also wanted to thank the first 2 panelists. Both of you were fantastic. Wow, look at the results before Dr. Powell spoke though, right? Half. Those are big numbers. And I think sometimes when we see 50%, you say, oh, well, it's just half. But statistically, when you look at stuff like that, that's a huge increase, right? And again, I love the language that you use, Dr. Powell, about social experiment. I could extrapolate that and go further with the whole social media concept, and we could spend 3 hours talking about that right now, because I do believe that teens are growing up in a social experiment just based on the fact that their entire lives are being projected. And I'll kind of talk about that a little bit, but I'm going to focus primarily on substance use. Some of what I say might be a little concerning. I'm also going to focus really on the South Bay specifically. And my goal is for this to be actionable and helpful to parents. So I'm going to talk a little bit about kind of the whys, the what's, and the hows, what we can do about it, what's really happening, and why some of this stuff is happening. You know, I'm not going to use a ton of statistics either, but just as a quick little, you know, Edna actually referenced one of the exact same statistics I was going to use, which is 23% increase in substance use, right, with adults. That's a huge number. Almost a quarter of American adults are reporting that they're increasingly using substances to kind of deal with the stuff that's going on. And correspondingly, we've seen an 18% nationwide overdose increase, right? So coming on the heels, and I hesitate to even say the heels because that implies that it's over, but coming on the heels of an opioid epidemic, we're still seeing that number go up, and it's in no small part as a result of COVID-19 and kind of the changing dynamics that we've all had to deal with in our lives. You know, so what are some of the things that teenagers specifically are going through? Totally independently of COVID-19 existing and of lockdowns and anything like that. And one is feelings of powerlessness, right? I'm a teenager. Where do I fit into the world? What sort of agency do I have? What can I really do? I'm living in a world of adults. feelings of helplessness that go along with that, right? And feelings of confusion. The teenage years are a time that we're supposed to be individuating from our families. It's a time that we're supposed to be connecting to external social groups, developing an identity of our own. All of those things that happen primarily in person, right? And in-person interactions as these developmental stages are taking place. And a lot of that happens at school, right? A lot of that happens at extracurricular activities. And so we have this whole chunk of what it means to be a teenager, and as well as now the added stressors of re-emergence coming into the picture, right? And so these changing social dynamics, and it's going to be natural that we turn to coping mechanisms, right? Some of those coping mechanisms are healthy, and some of those are unhealthy. Dr. Powell also referenced a really important point, right? This lack of structure. So, so much, and you see this with individuals that struggle with substance abuse also as adults, right? I primarily focus and work with teens and young adults. So emerging adults, I would say, is the category as people transition from adolescence into that 17, 18, 19, 20 years old range. And what we see is how imperative that structure is, right? How imperative to have a healthy structure in their life, to have healthy routine. It starts to allow them to model good behaviors. It starts to allow them to build self-esteem. It starts to allow them to connect with other people in a positive way. And a lot of that's kind of been dismantled as a result of the pandemic. And now, as we're going out of the pandemic and we're starting to reopen, we start to see some of those things, people scratching their heads where it's like, how do I fit back into this, right? And so one of the biggest maladaptive coping mechanisms that we see manifesting to deal with that is substance use, right? So, it's interesting because oftentimes, so we work at Clear Recovery Center, we work with both teens that are dealing with mental health struggles as well as teens that are dealing with substance abuse issues. And so I think it's really important to kind of define terms. And I hesitate to use things like addiction, to say words like addiction when you're talking about a teenager, right? Oftentimes it's premature, right? Now, it's generally what we're seeing is substance use among teens is a manifestation of other things that are going on, right? Like I said, it's a maladaptive coping mechanism. And so when you're in a situation where even all the adults on here are talking about the heightened stress levels, right, that are coming up, it can be really, really easy. And it's very understandable to go and turn to things that we know are going to make us feel better, right? I'm going to look for something that in the moment I can dependably rely on to make me feel better and deal with the stress, deal with the different changing scenarios, deal with the self-consciousness, just all those things that generally go on as a teenager that are now being amplified. And so substance abuse comes into the picture. So what are we seeing, right? What are we seeing here in the South Bay? And then what are we seeing on more of a macro level? Well, in the South Bay specifically, we're seeing amongst teens a lot of increased psychedelic usage, right? So especially around the start of the pandemic and continuing onwards, we're seeing a lot of kids that are experimenting with research chemicals. So things like LSD, but also these lesser known substances that they're getting online, some of which have like dubious legality, a lot of analog substances that are kind of popping up as quick as we can stamp them out. We're also seeing a lot of things like, magic mushrooms, things like that on the rise. So one of the things we can attribute that a little bit to is this sense of escapism, right? So we're isolated, we're locked inside. We're going to kind of turn to these substances that can be used in an escapist way, as a way to kind of get away from all this. We're also seeing an increase in prescription drug usage. That's kind of been happening at a pretty steady rate. So it's not too surprising, but definitely a lot of benzodiazepine usage. So Xanax, primarily amongst the high school age kids. I'll talk about that in a little bit, but that one is particularly dangerous in conjunction with the opioids for a couple of reasons. One, just because of the fact that when taken unsafely, benzodiazepines can be lethal. But additionally, because so many of the prescription drugs that teenagers are getting their hands on nowadays aren't what they appear to be, right? So many street prescription drugs nowadays are they're manufactured by someone that doesn't know what they're doing. There's no quality control, and oftentimes they're laced with numerous other substances. Obviously the opioids, I kind of touched on it a second ago, but we're just seeing more and more fentanyl, specifically here in the South Bay. I think all of us are aware of some of the tragedies that have happened in the last couple of years. and it's heartbreaking, but the South Bay is amazing of a community as it is. We definitely are not insulated from that stuff that we see on the news, unfortunately. And then the big one that I see that oftentimes gets kind of overlooked is cannabis use, right? As a whole, we have very permissive attitudes towards cannabis in California. And so, and I'm not here to comment on any sort of political debate surrounding that, but what I will tell you is we are seeing a direct correlation amongst teenagers. And I would be curious actually to ask some of the other professionals on here that work with children what they're seeing in their respective facilities. But we're seeing a correlation of an increase in psychoses as a result of cannabis use amongst teens. We're seeing an increase in teenagers and young adults that previously wouldn't have met the criteria for risky behavior per se, right? That are now ending up hospitalized, right? I'm seeing, 5-6 years ago, it was pretty rare for me to see someone that was like hospitalized due to cannabis use, right? We're seeing it all the time now, right? Oftentimes, generally in conjunction with a mental health issue that sometimes was completely undiagnosed prior to the incident with the cannabis, right? So again, I think it's too early to kind of draw a linear like causative versus correlative lines between, is this the cannabis causing it? But like what I can say is anecdotally, there's been a definite increase in what I see as a strong correlation. I'll say correlation, not causation, but a strong correlation between the heightened potency of the cannabis that our teens have access to nowadays, and the number of hospital visits and things like that. And so, in the home life, it's causing a lot of different reactions, right? So for one, parents are feeling overwhelmed independently of all this, right? As a parent, you guys are dealing with a ton of stuff. There's financial insecurity, there's emotional insecurity, there's the fact of being on top of your partner 24/7 in some cases, which even the healthiest marriage can struggle with that. And as a result of that, oftentimes there's this increased permissiveness that we're seeing, right? Well, I don't want to rock the boat. My teen's going through a lot. And so if they're smoking some weed to deal with it, if I caught wind through their social media account that maybe they took some LSD or something else with their friends, I don't want to rock the boat and I don't want to make a big deal out of it. Oftentimes parents are feeling guilty because of the stress at home, right? Am I responsible for this? Am I creating this environment? And look, there are definitely situations, and I think that Dr. Powell again did a fantastic job with kind of articulating some of this, where there is space for us as adults to look at ourselves. There is space for us as adults to kind of to look in the mirror and say, what work can I do on myself to benefit myself as well as the greater community and my immediate family. But we're definitely seeing sometimes adults that are reacting to that way, and they don't want to disrupt what they feel is their teen's life that's already been heavily disrupted, right? So they're less apt to kind of hand out consequences. They're more apt to kind of default to denial or ignoring that there may be a substance use issue going on. And it creates a dynamic where, again, these parents want the best for their kids, right? They want them to be healthy. They want them to be happy, but they're also feeling isolated in the midst of this, right? They also feel a little bit cut off from resources, which is a pretty natural response. And just like we talked about the re-emergence being a struggle for young people, it is for adults too, right? I've become so accustomed to living inside of my bubble. I haven't had to have person-on-person contact, and all of a sudden I'm being expected to go back out there into the world and navigate this. And how is it going to feel being back in the office with coworkers? How is it going to feel not having my eyes on my kids 24/7 or thinking I do? And so you've got these kind of parallel stressors that are taking place that reverberate through the whole household. So what are some of the things that we can do to address this, right? What are some of the things that we can do as a society, but also as individual households to address this, because again, it's no secret that the substance abuse is on the rise. It's no secret that fortunately or unfortunately, the consequences of substance use oftentimes can be deadly, or when not deadly, they can lead to some of the other situations we discussed, such as psychiatric situations that are very, very dangerous, that sometimes we're seeing teens, may or may not ever come back from. And so one of the first things that I always talk to families about when you suspect that there's a substance use issue, but even before that, right? Even before there's ever any suspicion that there's substance use going on, is open lines of communication. And it sounds so cliche, right? It sounds so standard, and everyone talks about how important communication is, but I can't stress enough how big of a thing that is, right? It's so imperative that families and that children and adolescents and teens have the ability to communicate with each other, that there's a safe space where that communication can take place, and that there's structured opportunities for that communication to take place. So I feel like I sound like my father when I say this, but having those set times for family dinners, right? Having those set times for those opportunities, even in the midst of the pandemic, even when everything's chaotic, even when you've been on top of each other all day and you just want some space, having time where you can put the cell phones away, where everyone knows there's an expectation to be there, and just reconnecting with each other, and not having these serious, and sometimes it'll be serious conversations, but creating a space where you can have these lighthearted and enjoyable conversations and really connecting with one another as a family. That's going to create an opportunity for some of these things to naturally come up in dialogue. And it's also going to create an opportunity as parents who know your kids better than anyone else. It's going to create an opportunity for you to get a good barometer of what's going on, right? You can pick up on things when that regular communication is happening, because you start to notice those otherwise imperceptible changes that might be taking place. The next thing I would say is, don't ignore the red flags and the warning signs. We kind of talked about it again when we talked about this increased stress levels of what's going on coming out of the pandemic. But the worst thing that you can do for your child or your loved one is, when you suspect that there may be an issue, and this goes for mental health or substance use, by the way, the worst thing you can do is, when you suspect that there may be an issue, ignoring it because you don't want to disrupt their extracurricular career, their college trajectory, their AP class that's coming up, their, and fill in ad infinitum. We can fill that list in, right? And it's always from parents that really, really mean well. But I can tell you, almost invariably, by the time that we're working with a young person and the situation has gotten more severe, and we're kind of doing a retrospective with the family, right, of what's the trajectory to getting here, there's almost invariably situations where we said, we're going to push this to the side and ignore it because we don't want to disrupt all these other things that are going on that we believe are so important for the trajectory of my loved one's life. Kind of in conjunction with that, don't be afraid to establish boundaries, right? So, I think this is something that's hard for parents, for a lot of parents all the time, but again, especially during the pandemic, but being willing to establish boundaries and stick to them, right? That can look like things like curfews, that can look like things like mobile device time, and that can look like things like drug testing, right? All of this stuff ties into substance use. All of this stuff ties into risky behavior. But, I think oftentimes parents can get caught up with, well, I want to be my kid's best friend. And they'll conflate, well, you told me that we need to have open lines of communication, with, we don't need to have any boundaries inside of the household. And it is possible to have a space and have an intimate relationship with your loved ones while there's still healthy boundaries, right? And I think that's very, very important to remember. And then finally, and perhaps the most important, if you do start to notice, right, if you've gone through kind of those things and you do start to notice, hey, there are some of those red flags are coming up, do not hesitate to reach out to professionals. We have such a robust network of professionals in the South Bay that do fantastic work, right? And that can look like a lot of different things. That can look like counselors, that can look like therapists, that can look like outpatient programs like Clear Recovery Center, that can look like substance abuse professionals, that can look like clergy members if your family is a member of some sort of a religious body, right? But not being afraid when those situations come up to ultimately reach out, and when you determine that there's an issue going on, take those next steps. Again, I can't tell you how often we see outcomes that can be heavily influenced by if and when a parent decides that, okay, enough's enough and we're going to get some professional help. you know, we really, again, can see a direct correlation between the success of the young people that we work with and the engagement and willingness of their families, right? Especially, and that goes to say for adults too, that are dealing with substance use issues, right? But especially for teenagers, I can't stress how important it is, how much of a role family involvement has to play in the picture, right? You know, and everyone's at a different stage, right? Some people, there are not every situation, here's what I'll say, not every situation warrants the same response, right? Not every situation warrants the exact same professional intervention. Not every situation warrants the same type of reaction from a family. And again, that's where it can behoove you to really reach out to professionals and ask for help. There are people, some of whom are on this call or on this panel right now, we've made this our career, right? We've made this our job to specialize. So, you know, I would say that making sure you're aware of that and making sure you're willing to kind of reach out and talk to professionals where appropriate. So it's been a pleasure chatting with everybody. Thank you so much for having us on here. And that's all from me.
Thank you, Howard. Appreciate it. So we're going to just move right into, just so we have most time for us to hear Dr. David Hart, who will speak mostly to the senior population. Then I'm going to just really encourage folks, if you have questions, please include them in the Q&A. And then we may go about 5 minutes over because we've heard such great information and we want to allow at least a little bit of time for questions. So with that, Dr. Hart, take it away.
Hi, well, thank you. Good afternoon to everybody out there in cyberspace. It's a pleasure to spend part of my afternoon with you. I'm very aware of time, so I think that the other panelists did a really good job of providing context regarding where we are, or actually where we've been and where we are. So I might sort of jump ahead in my slides so I can get to more specific interventions that we can maybe even practice together. So one of the things that I wanted to start out with, and as I was hearing folks talk, I mean, I could feel my own anxiety start to kind of ratchet up, right? Because it has been a year. It has been a year. And so hearing about it and sort of reimagining it, going back to all that's happened over the last 16 months, it's stress inducing. So I just wanted to take a moment because I know for me, I've lost 6 patients in the last 16 months to COVID-19. My husband was diagnosed with COVID-19 and was sick for 14 days. And I feel the presence of, or the need to acknowledge what we've lost. So I would like to just take 30 seconds, if we could, together to just create some space to acknowledge what we've lost, to acknowledge what we've come through, and to be together as a community in that. So if you're spiritual or religious, you could say a prayer. If you're not, you can just hold space for that acknowledgement. So we're just going to take about 30 seconds to do that. Okay, thank you for for engaging me in that way. So if we can go back to our slides, I just wanted to say, you know, at the forefront here, older adults they really had the burden of COVID-19, right? 8 out of 10 COVID-19 deaths reported in the US were of adults 65 plus. And this is especially more profound for people of color and other oppressed communities. And so this is, you know, there's a lot of grief attached to this. It was a trauma. It was a trauma. And so many of my clients not only are experiencing prolonged levels of grief, but also experiencing some degree of survivor's guilt. So I just want to say, I want to normalize in so many ways what you're feeling and what you're experiencing. This isn't just something that's going to be brushed under the rug. So if you're feeling anxious, if you're feeling stressed, if you're feeling overwhelmed and depressed, Yeah, right? It makes sense. And so the question is, what do we do about it? How do we help you? So if you could go to the next slide, please. So if you look at this data, right, this is a survey that was conducted early in the pandemic in June of 2020. And I think you might notice something very unique about these numbers, the survey data. Older adults were really reporting, subjectively reporting less incidences of anxiety, depression, and other trauma and stress related disorders. So really significantly less. And so we had to start asking the question, what may have been buffering them from experiencing more depression and anxiety early on? So if we could go to the next slide, please. So one of the things that we know about older adults is that they really have this like longevity. They can look back and they've been through moments in time that have been extremely stressful and transformational in society. So we're thinking about the Depression, we're thinking about World War II, we're thinking about the Vietnam War, we're thinking about, economic collapse in the 80s. I mean, so much has happened over their lifetime. So they have some perspective, right? And they've learned strategies to adapt to change. And we like to consider this as a vital, right? A vital reaction to change. And so that may have been what was buffering older adults early on. But we especially know that their social connections were so important. So we assume that over time, because we were isolated and because we were developing higher degrees of loneliness, it was as a result of some of that frayed social connectivity, right? So as we're thinking about moving into the future, it's like, how can we reinforce some of these buffers that were so protective early on? So if you can go forward here. So we know that we're seeing 16 months in. So this was a study that was published in the journal Nature, and it was published last month. So we know now that we're seeing increased levels of depression, we're seeing increased levels of anxiety, we're seeing increased levels of agoraphobia, and that has a lot to do with this decline in activity level that was discussed earlier, sleep disturbances, and also cognitive impairment. And I just want to say that there's not a whole lot of research on older adults who are caring for a spouse or caring for their grandkids. And I imagine that's a whole area of research that needs to be focused on. But I can imagine that these stressors, those types of stressors, would really exacerbate some of these disorders in their life. If you can jump forward. So we're not going to focus on this. We've already addressed this early on. If you could go forward. Okay, so some considerations moving forward, because I really want to get into the interventions part. So we've all been saying it's okay to not feel okay. That's the primary message today, right? It's okay. It makes sense that you're feeling overwhelmed. The question is, what do you do about it? Right? So the first thing that I want to teach you today is to learn how to label your feelings, right? Because a lot of times, especially for older adults, we have that sort of cultural value. Well, cultural value, that's sort of later, but many older adults have a cultural value about a stiff upper lip, right? So pulling self up by bootstraps. This is a very white individualistic perspective. So I don't want to get into that today, but we'll just sort of take it from that perspective. So I just want to teach you how to slow down, right? Because I'm feeling like I'm going very fast too. So let's take a moment to slow down, right? To pay attention. So let's do just very briefly a body scan, right? So I want you to get comfortable wherever you're sitting at home, right? So you're getting comfortable. I want you to plant your feet firmly on the ground, right? I want you to get as comfortable as you can in your chair. Now I want you to practice with me. We're just going to take 3 cleansing breaths, right? We're going to do a deep breath in through the nose and then an exhale through the mouth. Okay, that's it. And you can breathe. It doesn't have to be deep. You can breathe at your own pace, but we're just going to focus on our breath. So let's do that now. 1, in through your nose and exhale through your mouth. In through your nose and exhale through your mouth. In through your nose. And exhale through your mouth. Now I just want you to pay attention. Where are you feeling constricted, tight, tense, anxious, overwhelmed? Just scan your body from the top of your head all the way down to the bottoms of your feet. Just pay attention. Also pay attention to where you're open, where you're hopeful, where you're curious, where you're interested. And just say it out loud. Say it out loud right now to yourself. Just label how you're feeling. When we're able to label how we feel, it helps to regulate our nervous system, helps to bring us back to homeostasis. So labeling your feeling is an excellent way. And so that breathing that Edna talked about earlier, the body scan, and then labeling it out loud, not brushing it under the rug or sweeping it under the rug, right? It's okay to take your time. We have the urge to overcorrect probably because we've earned this, right? We've spent 16 months in hibernation and we're ready to get out and play and experience all that life has to offer. But some of us, especially older adults, are still immunocompromised. They still have chronic health conditions. We still have folks out there that aren't vaccinated. And we have mixed messages from the government regarding, like, should we wear a mask? Should we not wear a mask? If we're in California, we don't. If we're somewhere else, we do. So you need to address all of that and find your pace, right? The pace that you're comfortable with. I'm sure some of you will continue to wear your mask whether the government says yes or no, right? It's just something that you're going to do to protect yourself. So just go at your own pace. We also want you to get connected, right? And so Beach Cities Health District has wonderful ways for you to get connected. I'm sure they're going to go through all of those resources, but find the people that you trust and have those dialogues, right? Are you vaccinated, right? How have you been social distancing? What is your understanding of our dinner party? What is that going to look like? Some of you are going to need a whole lot more hand-holding and a lot more structure around that, and that's okay. Just open up the conversation, have the dialogue. And then, of course, talking it out. You want to have conversations with healthcare professionals to ease your concerns. No question is a bad question. Keep asking your questions until you get an answer that really satisfies you, right? So that you can feel confident and secure to go back out into the world. Next slide, please. Okay, so Beach Cities Health District has a wonderful mental health and happiness series. I'm encouraging you all to go there because they're going to teach you all about this stuff in a really dynamic kind of way, but I'm going to pick two today. So gratitude has a tremendous amount of research and evidence to support its efficacy in helping you to regulate your nervous system, to really give that balance, right? We're trying to broadcast. You're going to have the negative, and we're also wanting to broadcast the positive. So we got to tune in there. So on the gratitude part, this is the strategy that I want you to practice. It needs to be 21 days, right? 5 things for 21 days that you're grateful for. But I want you to go one step forward, okay? You're gonna think it, you're gonna write it, you're gonna say it, and then you're gonna share it with other people. So thinking it and writing it, that's great. But if you want the most magical effect, right? You're definitely going to want to share it with other people, so you can get involved with Beach Cities Health District and do that. The other thing about savoring, I've had the opportunity to go out and meet with my friends again, now that we're all vaccinated. And I'm telling you, I am holding their hands. I am taking pictures with my mind. I am crying. I am screaming. I am howling. I am hugging, right? All of that is an opportunity to savor. The more that we can involve every sense, right, and engage it, it helps us to find the regulation that our body is really seeking. So when you re-engage and when you re-emerge, allow yourself the opportunity and the pleasure of experiencing every part of it. Slow down, slow down. When I have my cup of coffee in the morning, I'm telling you, I got an espresso machine and I love it. I have my 4 coffees to choose from. I've got my half and half. I got my sugar. I'm mixing and matching. I'm doing all this stuff. I'm smelling it. I'm tasting it. I'm making it a beautiful experience. I know this sounds trivial, and it's not to dismiss. I got 1 minute. It's not to dismiss the pain that you're feeling. It's that we want to acknowledge the pain, and we also want to be able to balance the pain. So next slide, please. I have 1 minute. So if you're feeling preoccupation with the loss that you've experienced, if you're feeling hopeless, helpless, you're not eating or eating too much, you can't get out of bed, you can't seem to get out of the house because the fear is too much, you're feeling overwhelmed even to just get a vaccine, call somebody, call somebody. Be in touch with a healthcare provider that you trust. Call me, text me, email me. I'll get you connected to where you need to be, okay? Don't wait, don't hesitate. That's all I got for today. That was like a lot in a short period of time.
Dr. Hart, thank you so much. As
Yeah,
always, you're so great. And I loved ending on some of the practical, just really things that people can take with them. I just want to acknowledge, we did get about 8 or so questions that were pre-submitted. And I really honestly believe that the panelists answered almost all of them. The one thing as we go to maybe gallery view is I want to welcome Dr. Bill Kim, and then maybe have our panelists rejoin us, because we did have one question that was vaccine related. And I think that just to sum it up, Dr. Kim, as people are becoming more vaccinated, and we also have those who are not vaccinated, there was a question about if you're vaccinated, about how or would I pass COVID-19 on to my friends and family, my grandkids, or those who are not vaccinated. And so I was wondering if you could just touch on that briefly, and maybe a little bit about expanding to the 12 to 15-year-olds that just happened last week.
Sure, I'd be happy to. But first, I want to thank this panel. I was so impressed with each one of you. A couple of you had me giggling, and I've taken some of your expert opinions. I'm going to spread it around. But getting back to our vaccination, so I guess the question is, if you're vaccinated and you're one of those individuals that gets a low-level infection, can you pass on the virus to loved ones that are not vaccinated? And that's a really good question. And there has been research to this coming out of Israel showing that those individuals that do get COVID-19 that have been vaccinated, that the level of infection is so little that viral shedding is extremely low, and we do not feel that you're able to pass the COVID infection on to one individual that's not been vaccinated. So you'll remember the messenger RNA platform is extremely effective, about 95%, at least for Pfizer. So those 5% that do get a little infection, it's usually subacute, and you don't pass it on to others. That's the message.
Wonderful, thank you. And I know we're seeing a big uptick in vaccines this week with the expansion of Pfizer to the 12 to 15-year-olds. So
right.
Thank you so much. Go ahead.
We're about 3% have been already vaccinated of the 12 to 15-year-olds. And in our area, about the 16 to 17-year-olds is at 38%. So we're doing really well. Yeah.
Great. Thank you so much, Dr. Kim. So as we close, I just want to thank everybody who attended. I want to sincerely thank our panel. Just so much great information, and we're very excited to be able to put this recording also out on the website when we have it. I'd like to just in closing invite our panelists. I'll cue you up to just say something they're hopeful for. I think David, you kind of queued us up with that, and then we'll close with Lori. So Lori, hang tight for just a second. So something that you're hopeful for now into the future. Dr. Paul, I'm going to start with you.
Thank you. Before I give my answer, I would like to acknowledge Dr. Hart being his own barista. So, you know how I was talking about that savoring that cup of coffee? I guess he doesn't have to go to Starbucks or anywhere else. So that's awesome. What I'm hoping for is getting back to traveling. That is definitely something that I look forward to, and I'm very hopeful that it will happen very soon. So that is my one wish, to get out of my own bubble, connect with other people's bubbles, and hopefully poke them through. And if that happens in Greece or Ireland or Taiwan, I don't care.
Anywhere. Edna, what are you hopeful for?
I'm gonna say food. I'm really hopeful that the restaurants are opening up and that we're able to kind of break some bread with our family and friends and enjoy that time together. So
great, thank you. Howard, what are you hopeful for?
I'm hopeful on a big picture that we continue to kind of work together to combat some of these struggles that are happening in our community and every community, and on a personal level to start traveling again soon. So
great, thank you. Dr. Hart.
I am hopeful. What am I hopeful about? Travel is probably a big one for me, but I think what's most present is that we're starting to reconcile some of these racial injustices, and I'm hopeful that the momentum is going to continue this year and beyond.
That's great, thank you. So Tiana, as Lori is going to close us out, I'll introduce you just a second, Lori. I'd like to put up the resource slides so that we can make sure that people see all the amazing resources that were mentioned, but also that that we have in the community. And Lori is the chair and co-founder of the Redondo Beach Chamber of Commerce Health and Wellness Committee. And it was really their brainchild to focus on this topic. So wanted to say a really sincere thanks to you guys for raising this issue and partnering with us on this event. So Lori, I'll turn it over to you to close us out.
Thank you. Thank you so much. Hi, everyone. My name is Lori Glover. I'm with Silverado Beach Cities. I just wanted to say a little piece about the Redondo Beach Chamber Health and Wellness Committee. We started this committee because we wanted to focus on the aspects of health and wellness that help the members both personally and professionally. Our committee provides information to our chamber members about health and wellness, including upcoming events. So, if you want to check us out, you can look at the Redondo Beach Chamber of Commerce newsletter or Facebook page. And thank you so much for joining us today. This has been fabulous.
Great. Thank you, Lori. And again, as we close out, just a very, very sincere, heartfelt thank you to David, to Edna, to Howard, and to Iwana. You are truly supporting our community to, move through this and hopefully re-emerge healthy and happier and all of that. And so really appreciate your time and your expertise. So thank you very much to everybody.